there is a huge opportunity, probably for the next 6 months in this, no, 9 months in this financial year, and couple of years, at least 5 years, the healthcare will do very powerful.
So welcome to the Blue Circle, and thank you all for joining in today. It's such a big privilege and a pleasure to reconnect with everyone, our distinguished panelists who are handpicked because of the think input and the rich experience they bring in. And thank you to our distinguished audience for joining us. We've received over 250 registrations, and 90% of whom are CEOs and CXOs. Many of them are repeat visitors to our webinars. So this is very encouraging, and it motivates us to provide even higher levels of dialogue through the online channels as well. So for those of you who are new with us today, the Blue Circle is an ecosystem to help business leaders manage disruptive times and become future ready. We focus on 4 fundamental sectors, which are healthcare, real estate, retail, and e-mobility and energy. We also present socioeconomic insights, which ultimately determine the evolving complexion of the market. In response to the COVID challenge now, the Blue Circle has also accentuated its digital presence. One of the many modes we employ is our weekly webinar series, our digital publication. We're also building a handpicked domain-focused expert pool drawn from within our leadership community, from our member base and its associates, that will guide businesses during and post-COVID in these 4 sectors. In addition to this, and we're very happy to announce this shortly, we are launching an exclusive digital platform for leaders, somewhat like the LinkedIn for leaders, wherein we will present them with the opportunity of connecting with people just like them. We'll also house high quality content, meaningful conversations, and discussions. So those of you who are interested, please do write to us. We will be reaching out to many of you as well in the next 1 month or so. And the topic for today's session is healthcare's evolving equation post-COVID. We've invited prominent practitioners and thought leaders from the healthcare sector and have tried to cover all the subsectors that make up the industry. In the best interest of time, I will just quickly mention their respective names and designations. We have with us Dr. A. Velumani, creator Thyrocare, Mr. K. Chandrasekhar, founder and CEO of Forus Health, Dr. O.P. Yadav, CEO and Chief Cardiac Surgeon, National Heart Institute, Mr. Rajiv Gulati, Strategic Advisor, PE, Pharma, eCom and Mentor, Consumer Health and ex-President Ranbaxy, Mr. Samir Wagle, Managing Director, Asian Healthcare Fund, and our moderator for the session is Mr. Pavan Choudary, author, CEO of Wagle India, Chairman, Medical Technology Association of India, and sits on several healthcare boards across the country. So thank you very much, sirs, for joining in today, and thank you very much, leaders in the audience. Kindly note that we will have Q&A towards the end of the session. Some of you have already shared your questions previously, and they are with the moderator now. And now I request Mr. Choudary to please begin the session, sir.
Thank you very much, Siddharth. Big pleasure to be with you all, and big pleasure to have such distinguished panelists on our panel. I will straight away jump to the topic, which is how has COVID impacted healthcare, and what are the challenges and opportunities which we see emerging in this sector? How has the sector changed, and how will we respond to these challenges and opportunities? So when COVID came, it was felt that it will be an unequivocal blessing for the healthcare sector immediately. However, I would like to know from the panelists today, has the impact been unequivocally beneficial, or it has been extremely mixed? And let me start with the people who are closest to the patient, or where the patient journey begins. That means the promoters from the diagnostic companies who we have with us. I'll begin with Dr. A. Velumani. And diagnostics, as you know, it is a small but very vital sector. 5% of the turnover of the total healthcare industry it has, but 95% of the expenditure it decides. Where the expenditure will go, it decides. So that is the vitality of this sector. I will ask Dr. Velumani to tell us, how has COVID impacted you, Dr. Saab?
Ji, namaskar. Thank you, Pavan ji, for making me a part of this panel. Yes, COVID has come abruptly, we can't say, but we weren't aware that there would be a complete lockdown. No one in the country knew. It was few hours before the lockdown it was announced. Our business, diagnostics business, largely depends upon logistics of specimen movement by air, train, bus, road, everything, but suddenly it collapsed. What was in the February in 1.5 crore turnover per day became 1.5 lakh turnover per day in the first week of April. And April and May, it was completely zero. And in the month of June, some parts of the country lockdown was reopened. But of course, many places they have again locked it. But if I have to say, in the month of June, we were 40% back. In the month of July, we are around 55% back. This is on the non-COVID business, which was a business which was 100% for us in the month of February. But this was the disruption. And the positive side was we were one among the laboratories recognized for doing RT-PCR for COVID. We've sensed it's an opportunity. We had a 200 tests per day capacity. So we ramped up very fast to today around 5,000 swabs per day. And if you look at it as of this week, the week which concludes today, we have almost 1:1 as a COVID is to non-COVID business, which means the disruption was for non-COVID. There was a creation for a COVID business. So the opportunity new is a new vertical. This vertical wasn't existing in laboratory as big as today it sounds to be. So if you ask me, there was some bag of problem and bag of pleasures. So we have managed, and maybe ours is little dynamic, so we could come out of it in 2 months period.
And today, as compared to 1.5 crores turnover last year per day, have you reached that figure of COVID plus non-COVID combined, or you are still not there?
The dynamic month over month is 1.2x, which says same period last year, if we had X, today we are having 1.2x. So we have got it back, not COVID alone, not non-COVID alone. COVID has supported.
Okay, so frankly, that means you are one of those companies which has been benefited in a nutshell positively. What about Chandrasekhar? Chandrasekhar, you have come out, you are the promoter of Forus. You have come out with telemedicine and medical technology devices of a different kind. How and which borders on public health in many ways, your ophthalmological interventions. How has it affected your business? Has it hit it? Has it buoyed it?
Yeah, I think our business is spread both in India and outside. And the first impact of that, so typically our last quarter is actually the most important quarter for us. We almost do 40% of our business in the last quarter, which is January, February, March. And we could start feeling the impact in February when the Europe business started to kind of literally become almost zero. The India business continued till middle of March. And given that we are a capital expenditure business, we could continue up to middle of March. And lockdown completely made from 15th of March the business to literally zero. Two things were in our favor. One is generally our April, May, June quarter is comparatively the lowest quarter for capital buying, because most of the buying happens in the last quarter, and people generally take vacation and all other things in India. So generally the first quarter of the year is always we forecast comparatively lower. But in our advantage, what we saw was that the Europe business, which shut down, started to open up in April, May. So we started getting back our business from Europe in April, May. But the complete OPD in India for eye care got shut for almost 70 days. And eye being more or less like an elective subject, there were absolutely, except for emergency care, there was nothing happening. So we kind of used this opportunity to build a lot of components for our teleconsultation. And that is something which we have started. Obviously, while it is getting recognition and it is getting implemented, it is actually not no way in comparison to the capital sale, because it will basically be coming to you in smaller, large numbers, but small value. So it will take up time to ramp up. But what it has done to us is basically helping us what we could not do for 3-4 years or 4-5 years in bringing awareness about teleconsulting and remote diagnosis to doctors and to patients. COVID has kind of bought it, without any choice. So that is, I see as a long-term advantage. But to give an answer specifically to respect to business, the India business has kind of suffered a little bit. International business has picked up in some countries. But one more positive thing we see from India is some of the old timers, which were, who were using, old methodologies of screening, because of they have to be closer to the patient, have now started to adopt certain modalities which will use technicians. So from that point of view, we see a positivity, and I think that will grow over the next couple of quarters. But I would say a little bit of a mixed bag.
Great. So basically what you're saying is that in terms of top line and bottom line, overall, there might have been a decline, but in terms of awareness about teleconsulting, about acceptance about teleconsulting, and also the resistance to teleconsulting has gone down, if science could not convince them or to change their habits, or technology could not, fear of proximity to the patient has been able to make them more ready to buy into your offer. Great point.
Absolutely.
Coming to Dr. Yadav. Dr. Yadav, you head National Heart Institute, a premier cardiological and full service hospital in the country. I would like to ask you, how has COVID impacted your business, the hospital business?
Oh, well, in one line, it has devastated all the hospitals across the board, those which focused on surgical specialties, little more than the ones who focused on medical specialties, orthopedics hospital, plastic and reconstructive surgery, ophthalmology, ENT, standalone centers, they had just completely routed. Cash cow status that we had to cardiology and cardiac surgery, they are been able to sustain themselves somewhere in between, but some specialties like pulmonology have actually flawed during this pandemic. It's not just that the hospital revenues have come down, it's the way they have come down. So we thought that there will be reduction in the number of routine cases coming to the hospital, but we were very surprised to see that even the emergencies were reduced dramatically. So whether that was an overzealous treatment we were dishing out, and there is a connotation of, some degree of malpractice, in medicine? Yeah, sure. Or was it a fear psychosis in the mind of the public because of miscommunication from all stakeholders right from the beginning about the disease process, that they were delaying seeking treatment is something where the jury is out. And to make matters worse, the government in its socio-political agenda, they sacrifice the private sector at the altar of that agenda. I mean, those are responsibilities which the government should have discharged to the population. They started demanding from the private sector by capping prices, which has further added to the woes of the medical profession. And lastly, the way we have been hit is because of the manpower. The manpower shortages have hit us very badly. And it is not just the absolute number of manpower, it is the skill sets that we need. There are certain special skill sets which are needed for managing pandemics like corona. Those are missing today. So it's kind of a multi-pronged loss to the profession.
Absolutely. I fully concur with you. Basically, you're saying that in terms of overall footfall, there was a huge drop, and in not only in elective surgery, but also in emergency surgery, which is somewhere pointing to the fact that some overzealous treatments were being given, or people who did not need surgeries were being treated. If the overall death rate has really come down, if it is so, and also the allegation of that this profession being a heartless profession is somewhere being confirmed, but the jury is still out, because you were the other day telling us about the Lancet study, where and I would like you to touch on that has the overall death rate really come down? All-cause death rate, has it really come down post-COVID? Or there is some other reels in this film still to play out? Dr. Yadav.
Well, the answer to your question is twofold. One is a formal answer where we come from published studies. Then we have had a couple of studies, for example, from Lombardy in Italy, which was the initial nerve center. They have noticed there has been a marginal increase in non-COVID mortalities out of hospital mortalities. So they are thinking in terms of, did heart attacks not come to the hospital, so they were dying at home? But if you look at Indian statistics, and there have been no formal studies, but informal by more people like you, the journalists, they looked at the records, the burial records, the cemetery records, the cremation records. There was no countervailing increase of mortality from those records, which I think are very fair and very robust. You can't fake those records of people dying, they can't be hidden. And in India, actually, we did not see any increase in mortality, which is a good leveler for the medical profession, for us to, introspect that what we were doing, was it truly justified?
And isn't it true also, Doctor, to see it from the other side, that the only 70% of the deaths which happen in India are registered, and many a time the cause of the death is not accurately captured. And also there is one group of people who is saying that before we conclude that all-cause death rate has gone down after COVID, we should also look at the swabs of people who have died in accidents, etc. What's your view on that, Dr. Saab?
Well, that point is well taken. We know that for every one patient that you come to know that he has got a COVID, there are 30 patients who are there in the society which are COVID positive and have not been tested. And even the tests have sensitivity, which is, I think, is somewhere in the range of 70%, because you may do a test when the person may be in the incubation period and may not show the virus or the antibody to the virus. Now, the point that I want to raise another point on this, if you permit me to. It is now we are concentrating on COVID. We are totally oblivious to all other health diseases that we were confronted with. And that is what the Lancet Health Network study, which came out just 3 days back, which is not an actual study in the sense it's an epidemiological modeling. So I hope they are proven wrong, but if they are right, they say that deaths due to malaria are going to increase by 36% over the next 5 years, tuberculosis by 20%, and HIV by 10%, because all these programs have come to a standstill. So all schools are closed, midday programs are closed. So what happened to the nutritional status of the children? What happened to the mental and the psychological damage done to the mental health of people who are under lockdown? All these are issues which are for the future. We don't know much about that today.
That's a brilliantly equipoised perspective, that there may be some threat building behind the dam of infectious diseases, etc. While we are totally focused only on COVID, there might be other things coming very soon. And also, some studies are saying that patients who are suffering from kidney-related disorders, diabetes, etc., might be becoming worse and worse, and their case might become very critical of that cohort might become very critical in times to come. Great point, Dr. Yadav. Coming to Rajiv Gulati, how has COVID impacted the pharma sector?
Pavan, I would like to break this down into different verticals of the sector, for example, the industry and trade, and also within industry to different product mix. And the impact is not equal. So if we look at the pharmaceutical industry, then you have to break it down into 3 different components in terms of products: acute, chronic, and I would say to some extent self-purchase or OTC sector. So if you go by sheer numbers, and first it was anecdotal, and now I have the latest AVAX data as well with me. So if you look at anecdotal, I called the president of one of the largest pharma companies of India, is the president of the Indian operation. And I asked him what happened in April, for example. So his point was that if you look at the chronic, which is the blood pressure, diabetes, cholesterol, thyroid, which people have to take for years and years or for a lifetime, then the chronic segment had actually grown over the same period last year. So people need food, people need medicine. So if you need to maintain your blood pressure or your diabetes, you are going out and buying medicine, whether the OPD is open or not, whether the doctor is available or not, you are going and buying your medicine because you have to take care of your chronic situation. But if you look at the acute side, there was a dip in that. And the reason was very clear, because OPDs was not there, people were not going there. Maybe people were not getting infected because they were staying at home. So infections were down and antibiotic sale was down, or maybe painkiller and the antipyretic sale was down. So it did impact differently. The acute was down over the same period last year and the chronic was up. But on the OTC side, I think the impact was much larger because people were not actually entering the shops. The shops were asking, what do you need? And people were buying only the essential medicines, and you would not enter the shop. You would stay outside, you will ask what you need, and somebody will come from inside the shop and give you. Now, if I talk about what happened to the retailers, I called several, and initially their sale had gone down to 1/3. And that is where you see these chemist retailers. This segment was also selling cosmetics, also selling OTC and Ayurvedic products and others. Initially, their sale was almost down to 1/3 for a period. And then it is picked up to about half of the normal sale. So while the chronic segment continues and the acute is down, my point to you is that the OTC segment is also down. Because this is a discretionary purchase and people are buying only the essentials which they need. And they are not entering the shop and nobody is able to talk to them. They are not able to see the displays or able to buy them. But talking about the trade, again, there is a differentiation. I talked of the retail segment. And for a minute, let me talk about the e-pharmacies. So I talk about the e-pharmacies, the conversation I had with them, in the period April-May, they showed actually a spurt over previous months and of the same month last year. because people wanted to get medicines delivered at home. And that gave a boost to e-pharmacies. And please, let's understand that e-pharmacies, as it is, focus on the chronic part of the business, because that is where you can wait for 2-3 days and then you buy for the whole month. And acute, you want for 5 days or 3 days, but you need immediately, and you go to retail pharmacy and buy. So that factor also benefited e-pharmacies, along with the fact that people wanted home delivery. So that segment also gained. So in general, this was, if you look at trade versus industry and online versus offline. But the other impact was on the product mix. Because if you talk about the industry, there are companies which had product mix more skewed towards acute. And there were those which were more skewed towards chronic. Obviously, those more skewed towards chronic gained. But the other was COVID related. For example, if the company was into steroids, the sale obviously went up. If it was into hydroxychloroquine, for example, Cadila and Ipca, then those products they sold a lot. But if the new launches like Remdesivir, which is Mylan and Hetero and Cipla, then they also gained a lot, or Glenmark, which launched Favipiravir, the first and the only one so far in India, and it got an immediate boost. So you can't say everybody gained or everybody lost, but depending on what sector of the industry you are in and what is your product mix, you gained or did not gain with the impact of COVID.
Absolutely. And I feel you're absolutely right in saying that some surged and some fell. And also the online retail, not only in the medical side, we found that all over the sector, online retail really came to rescue retail or retail sales. And this was, of course, a technological marvel which we had this time. It was not available in the last pandemic in 1918. And the other thing also, with pandemic anthropologists have said, is that the refrigerator also came to the rescue of the retail salesmen, particularly in the injectable and other to be refrigerated medicines. Great point. Coming to Samir. So Samir, you have heard from across the spectrum that some sectors are doing well, some sectors are bleeding badly, and some subsectors of pharma, as you saw, are doing well and some are not. What is the view of the investor, and how has investment been impacted in the post-COVID times in healthcare?
So I agree with my co-panelist. I think it's been a mixed bag. So for investors in the short term, I think the focus has been more in terms of managing the current investments that the investors have. The appetite to do new investments has reduced. And even in the current portfolio, companies which have discretionary or elective businesses, or which are present in metros versus tier 2 cities, and which are customer facing, have got impacted more. So even in our portfolio, there is a business which operates within our hospitals, but largely in tier 2 cities, that has recovered much faster. We also have a company which is providing dental services. That's in some of the major metros in India. That has got impacted more. So in the short term, it is a mixed bag. There is pain across sectors. Some subsectors have got more of it. But the good news is that I think if you look at the medium to long term, COVID will be positive for the healthcare sector, because from a situation where for all stakeholders, whether it is investors, whether it is the government, whether it is the consumer, the normal citizen, healthcare will become a priority now. So therefore, the mind share, the wallet share, all of that will increase. And therefore, I think it is quite natural that once things normalize, and even in the interim as things start improving, we will see a lot more investments getting into the healthcare industry, whether it is from specialized healthcare funds like ourselves or general private equity funds and others. Also, what I think COVID has done is a disruptive event, once in 100 years kind of event. It has clearly accelerated certain trends in the healthcare domain, which I think will be very positive for organized healthcare players and investors like ourselves. So, for example, formalization and consolidation in the sector. So, if you see the Indian healthcare space, we have a large section of the industry being unorganized, mom and pop players who are operating kind of below the threshold, not meeting the normal regulatory standards and so on. So what will happen post-COVID is there will be a flight to quality, a movement towards more trusted brands. So formalization, consolidation will take place. So the weaker players, the smaller players will have to either improve their standards or will have to merge with the more established players. Second is this whole digitalization. If you look at other consumer-facing industries like financial services or education, technology has been far more active there as compared to healthcare. And healthcare has been resistant for various reasons, both resistance from the consumer and the practitioner. I think what COVID has done is to remove a lot of those old mindsets. And hopefully, even after COVID goes away, this whole health technology business, which is very positive both for the provider and the customer in terms of improving efficiency, improving efficacy of delivery, will really continue taking off. The third major trend I see is kind of decentralization. So, we have this situation where you had large hospitals which used to do all the end-to-end healthcare activities. Increasingly, what I believe we'll see post-COVID is more decentralized approaches with specialty clinics, single specialty, multi-location kind of networks, less capital intensive, closer to the customer, taking off, which will help the industry from multiple fronts in terms of making the customer experience better, in terms of getting access to more talent and so on. So that's the third. And the last and not least is the whole disintermediation, where direct to consumer approaches, where healthcare services will be delivered closer to the customer, will kind of take off much stronger. So all these trends, formalizations, digitalization, decentralization, and disintermediation will, I believe, be very positive for the sector and therefore also for the investors who invest in the sector.
Very good points, very well rounded up. And what you have said is, first is, right now, so far you have experienced caution. Now you are about to experience greater interest and abiding interest of private sector funds. And I do not know how the government will, or for example, our government will have surely a high desire to invest more in healthcare. Whether its desire will be met with a commensurate ability to invest in healthcare is still to be seen. As far as digitalization is concerned, you're absolutely right. There have been studies after studies where patients would have wanted not to interface with doctors, especially many a time intimidated by the entire setup, as well as sometimes the little cavalier behavior. So the digitalization was already on its way, and I think it will be much speeded up. And the point about decentralization on micro hospitals is also very well made by you. Great, Samir. Coming back to Dr. Velumani. Dr. Velumani, so what do you think are the challenges and the opportunities which are arising on your business landscape, and how are you getting ready to meet them? Dr. Velumani, you have to switch on. Yeah.
The challenges are still COVID is not out. and still the fear is not out. Still the doctors who are dealing with the non-COVID are still to find a chair to sit. Though some telehealth or telemedicine is on, it is going to take a little longer time. And the fear of COVID still escalating remains in tier 2 and tier 1, tier 3 cities. Having said that, the entire healthcare industry will split into COVID and non-COVID. There will be two kinds of hospitals, and infection related and metabolic illness related. So that's going to be a new religious segments which business has to handle. We look at COVID business to be a good size. In fact, my positive thinking is the size of the COVID business will be equivalent to that of the non-COVID business by probably December. So which means COVID test will have a larger say. In COVID also, there are two kinds of tests which are promising. One is the RT-PCR test, which is still having a huge demand because it is the test which can confirm the presence of virus. There is an antibody test, and this antibody test has been introduced only 1 month back. And a survey we have done across 600 pin codes across the country, which gives almost around 15% of the population having antibody. I want all who are in healthcare industry to understand what is the significance of these antibodies present in such a huge number. India has a death per million of only 20, and Western world has death per million of roughly around 500. So what keeps India safe was a very big question. People were doubting declaration of deaths, declaration of infection, adequacy of number of tests done. But it emerges from this antibody study that approximately 15% have got exposed. Trust me, this exposure of COVID will not vary from different to different, though the outcome will vary body to body, and probably from various parameters, it will decide how many will die per million. So I am of that opinion. This 15% of antibody presence says for every death in the country, around 10,000 people have got exposed. It is too big a number. I was very scared to conclude at this number. We had a lot of discussion. But it appears that after 150 days of COVID experience in the country, we have around 15% of antibody positive. And if you want to understand the significance of it, the metro cities have around 40% antibody positive, which means that those cities which had the brunt 1 month back today have higher percentage of seropositivity. Just telling this to you to give whatever is the latest observation says, the seropositivity gives the handling by the body, whether it is supported by all government's decision or not, but body has handled it pretty well. Why I brought this antibody as a subject is, it looks like in COVID there will be two segments. One is the RT-PCR molecular biology based test. Another is the antibody based test, which is a routine blood based test. Other one is swab based test. So coming to answer to your question, the country would have both for hospital and also even for pharmaceuticals, and more so for healthcare, a bigger vertical of COVID than the non-COVID. And we are one, of course, in entire healthcare, the job security is not an issue. People are not willing to work for longer because of lack of compensations. So we are very keen to double the number of HR, double the floor size, and double every capacity, so that the opportunity of doing a big size business in COVID is not missed out. So if I have to conclude, there is a huge opportunity probably for the next 9 months in this financial year, and couple of years, at least 5 years, the healthcare will do very powerful. And I have been thinking that man is not spending adequate in healthcare. In the last 3 months, the fear of man is very palpable. He will spend more. I was thinking government is not spending adequate, but I think government has understood the need for it. Probably Ayushman Bharat will put in a lot of money from this bottom of the pyramid. I have a reason to believe there will be more money in the pyramid, more money in the healthcare industry. All the stakeholders will do better. Organized will do much better. Bigger guys might do much, much better. This is my personal opinion.
Great points. And basically, your outlook is very opportunistic, whether it is the demand side or it is the investment side and even the HR side. And the other day you were saying that if we have earlier we told man to look after his body, he did not look after his body. Now he has to know enough about antibodies. So COVID has also expanded our intellectual.
Let me tell you for the healthcare colleagues who are listening, for the last 150 days, entire presidents, chief ministers, prime ministers, health ministers, health secretaries, MLAs, mayors, and all media, all social media have put in so much on healthcare. It wasn't otherwise possible without spending $1 trillion.
No,
and in spite of that, if healthcare is not doing well, if people think that it may not do very well, it's not a positive looking. It is an opportunity.
Interesting viewpoint. Very good. And I fully agree with you that this our horizons have really expanded. Even my house help, now he knows that the space above the door is not the only ventilator. He knows that there is another ventilator which saves lives in hospitals. Absolutely. And my mother also, who's 86 years of age and she's bedridden, she knows what is the meaning of supply chain now.
Also, people don't know what is oxygen.
What is oxygen?
Otherwise, people thought the oxygen is something must be happening.
Yeah, great. So that's a very optimistic and positive view. I would like to bring in Rajiv here and ask Rajiv. Rajiv, the medical representatives, their access to hospitals has got deeply restricted. Where do you think their fate is going now, or fate of workers like that who are engaged in promotion? And do you agree with Dr. Velumani's point of view that healthcare is going to be doing mostly positive in most of the areas? Rajiv.
Thanks, Pavan. Coming to the medical representative side, see, the changes had begun to happen in India especially, because all over the world these things have been changing. They go in cycles, they go up, they go down. The changes had begun to happen in India already. When I say changes had begun to happen already, the progressive companies I saw were focusing a lot more on, let's say, the electronic media or digital media to reach out to the physicians. If you want to provide knowledge and service, then you don't have to physically be there, and you don't have to wine, dine, and hold conferences with liquor only. So there are progressive companies I've known, which many years ago started working on the fact that they created a portal where physicians can go and access textbooks and access latest medical journals free of cost, and that's a service provided by the pharmaceutical company or by the industry, or creating a forum, online forum, where specialists can get together, specialists of one particular area can get together with each other and talk about real life cases and learn from each other. So, given that every medical representative who has 10 doctor friends thinks he can start a pharma company, and most of the pharma companies which have started, whether you talk of Macleod or Mankind or even Sun Pharma, they started people who were linked to sales and distribution in the beginning, and then created a pharma company. So everybody has that ambition. So India has the largest number of pharmaceutical companies in the world. We are extremely competitive. And doctors, as it is, you were pushing back on the number of reps they could meet, or how many times they would meet, on which days would meet, or what hours they would meet. Many hospitals have already come up with notices that they're allowed only at a specific day and a specific time, and that also with prior approval and getting a pass.
Sorry, just to interrupt you. That restriction you shared on another occasion also. I wanted to know, is there tribe threatened? Is a bloodbath coming? And do you share the optimism of Dr. Velumani, or you have a different view about some parts of the healthcare sector?
So I was coming to that. I took a little long to say that. I was saying the changes had already begun to happen. The COVID has merely accelerated the changes. That was my point here. And because of that, this impact on how many representatives the industry employs and how many are really needed, there is going to be, well, I don't know the bloodbath, but there is going to be a job challenge going forward for sure, where there may not be as many jobs as they were there pre-COVID, to my mind.
And the other point, do you share the optimism of Dr. Velumani about the healthcare sector, or you feel several parts of the healthcare sector might be not so easy to revive?
See, I'm ambivalent again, and let me very clearly explain why I'm ambivalent. Both on the out-of-pocket side, where people are spending for healthcare from their own pocket for themselves, and from the government, where the government is spending for the people, both. And there you see a difference between COVID and non-COVID. I already mentioned that chronic was doing okay. COVID, of course, is a new opportunity for several companies where they've launched products, and many of them are now Bharat Biotech and Panacea Biotech and Cadila and Serum Institute of India with AstraZeneca and Oxford University bringing COVID vaccines. So that is the positive side you see, which will benefit the industry and the players in that segment. But on the other side, people will spend only on COVID-related diseases and on chronic diseases. The discretionary spend will go down because if people earn less, just let me put it out to you. If we have situation with the hospitality industry, the hotels, the universities, the theaters, and the travel industry, whether it is train or planes or buses, if you find a challenge and if people in some, and the migration of labor which has happened because they left their jobs and gone back to their villages, if they earn less, will they have money to spend on discretionary OTC or other kind of products? I have a big question mark there. And also let me share with you the experience of several of my friends from industry, healthcare, whether it is devices, whether it is pharmaceuticals, whether it is others, who deal with the government sector. And we have all read in papers even before COVID, during COVID, the availability of capital has been an issue. So if the MSMEs want loan, banks are not giving. Government has not paid for the supplies for a long time, but they have started paying now. And except one state government, everybody is paying immediately or in time for all COVID-related supplies. So if there are MSME which is involved with supplies related to COVID, both the central government and more so because health is a state subject by constitution, it's not a central subject. Yeah. So all states except one state have actually paid out in time, and that has given a boost to the industry. But that has happened much more so on the COVID side and lesser so on the non-COVID side. So on the COVID side, yes, out of pocket and the government expenditure, industry will gain. But on the non-COVID side, it will be divided between chronic and acute, and OTC side will benefit less.
Agreed. I think you've very well made your points, as well as travel. You mentioned of patients, or even the medical device promotion people, etc., is restricted. There are many micro lockdowns, though there is a national unlockdown, and other difficulties in reaching out to the healthcare professional, both for the patients as well as the companies. So coming to Chandrasekhar, where do you see the challenges and the opportunities in your sector? And in your brief answer, I request you to also accommodate two more questions which have come. One is, will there be a perennial interest in telemarketing and digital consultations? And second is, what will be the role of IoT in the healthcare sector going forward, IoT devices?
Thanks. So I think I'll try to cover it up in probably 3 points. So one, if you look at devices itself, one of the problems which we will face is going to be on the supply chain, raw material supply chain, which is going to have a short-term impact. And that is going to also allow indigenous companies to come with components which was not being done before, and primarily it was imported. And more and more products or components which were part of being imported from China kind of places, there would either be alternative supplies, or there would be local indigenous industries which will try to kind of set that up here. Of course, it's not going to happen immediately, but I see that trend will happen. Now, one of the things which I think in hardware development which will happen is primarily most of the devices were made for hospitals. And I think COVID will drive a new segment, which will basically be devices for home care, which will be slightly different from what was required for hospitals. So I think answering your question on IoT, I think these are going to be devices which will help chronic patients to kind of, or patients to kind of maintain. Now, I also believe that people tried this before, and the reason why it did not take off primarily was because that the behavior of people when they are when you try to identify their problem for the first time for a home care was probably not working psychologically, because it has to happen in the hospital or at the community level. But the moment he's known chronic patient, then he would prefer, his behavior changes, and he would prefer to also like to be maintained at home. And given COVID, that you don't want to go to a hospital and you feel that you may get an infection, that will drive this. And so IoT devices, which primarily, I'm not talking about wellness devices, I'm talking about IoT devices which take care of certain measurements, which if it can be wherever possible to maintain at home, that is a segment which will grow. Now, and that cannot be standalone, it will grow because there is going to be this new emergence of this digitalization, right? So the standalone devices at home will not work if it was standalone, only when it is integrated with this large scale digitization, because hospitals are getting digitized, they have electronic medical record, now they can have follow-up patients. Then e-consultations will happen, because most of the chronic patients will try to do follow-up. And if you look at what Dr. Yadav talked about, the Lancet article, you're going to have a lot of chronic patients who are going to be left, right? Now, that disease management, whether in our case, like retinopathy or macular degeneration or glaucoma, will be maintained at home, for which there would be a software which will connect the doctor and the patient, and there would be hardware which the patient will have at home, and there would be some artificial intelligence which will only kind of trigger patients who have a problem. Only those patients doctor take care. So I think that is going to be the new opportunity, and that will also drive a lot. I strongly believe that there will be a lot of compliance. When I talk about compliance, I'm not talking about regulatory compliance, but compliance to disease, ensuring that I don't go blind, I don't get into a chronic problem. Those are the kind of things which I feel will happen. The third important thing which I think which will also happen is going to be the opportunity of collaboration with large companies and service providers for smaller devices companies, because now when you talk about some of these micro hospitals, you need to have a connectivity, a platform connecting all of them, and that cannot be provided by a large player or only by a service provider. But there will also be smaller players who can actually take one component and play a role, and then it will be like a total solution which will be presented to the given to the end consumer. So there will be a reasonable amount of change in the revenue mix a typical company will have, a medical devices company, and the more faster you will kind of adopt to this and move in that direction, because some of these software related businesses, even though it will give you traction, it can't give you the revenue in the volume of what a capex business can give. So you need to have capex business which will help you grow, but you need to have invested in this, because 2 years from now, when we have more people taking this service, then your cumulative effort will be far higher, and it will dramatically improve your bottom line.
Excellent points made. You have said home is also an area where we need to now look at more deeply. And also you have said that the chronic patient might wish to be treated at home, and he's of course much the richer by being treated at home, because home healthcare usually is 1/10 of the cost of hospital healthcare. Of course, other points will come up. Cyber security of these devices will be an issue. As you know, medical devices already have a security angle. A pacemaker can be hacked and the battery discharged and shocks given. So all those angles will come up, but beautiful points made. Let me bring the microphone now to Dr. Yadav and ask him, tertiary services, Dr. Yadav, just now Samir said, will witness a major decline and are facing right now a very big challenge, which you also endorse. How are you looking at the challenges and the risk and the opportunities in your landscape, and what is your plan to meet them?
See, the first and the foremost, I believe, for the health sector today, or the hospitals, is to get into advocacy and networking. And this was what Mary Lesker, the doyen of oncology, did. She failed in the laboratory, and then she started lobbying with the politicians for funding for cancer research. So today we need to first lobby with the government to create a policy environment to have a meaningful private-public partnership. I don't know who got into the head that profits is a detestable and an immoral thing to have. No, it's needed. We need to get into the head that even government institutions must work for a profit. They must incentivize. Second, I want that capacity building. Yes, the hospital, the beds needs to increase. Medical colleges need to increase, more doctors and nurses need to be produced, but more important than that, we need to look at efficiency, need to look at accountability and for appropriate skilling. So these are aspects which, advocacy would be required with the government. Coming specifically to the hospitals, just today, the latest issue of the Journal of American College of Cardiology has a wonderful article. In the last 3 months, during the COVID times, the average hospitalization is reduced from 6 days to 4.6 days. The hospitalization is reduced. And it is not that you're compromising the interests of the patient. Now you have the confidence. You can do home monitoring. You can do remote censoring. You can do teleconsultations. And you can provide domiciliary services, which just Chandrasekhar looked at. So we need to, change our mindset for it. And also we need to now leverage technology as we get on to doing more and more minimally invasive surgery. We will find telescopic and endoscopic surgeries, robotic surgeries. These procedures which require 10 days hospitalization will become day case procedures. So I think I endorse that view.
Great points, superb points. In fact, speaking about IoT, Internet of Things, I was reading a very good study where it is mentioned that a nurse on an average across the globe spends 21 minutes of her shift only looking for devices, just finding devices. So if every IoT device has a sensor or just voice sensor, She will save so much time, and which will lead to billions of dollars, as well as faster turnaround time for the patients. So that was the technology piece. And the other point which you brought up is even more central, that profits is not a bad word. Healthcare is one sector where you can do good and still do well. But if you do not do well, then you cannot continue to do good, because you cannot feed from an empty vessel. And historically, the sector has emerged in such a manner that the earliest hospitals were made by businessmen who were successful and in other businesses, and they were charitable organizations in their cities, or the government brought them up. But because now entrepreneurs have got into this sector and this is the only business they do, they should be allowed to make some decent profit, because of which they can fuel the engine and also have that incentivization which you said, for all the many years of work they put and the many risks they take. So that is surely very important. And I'm reminded of a saying that in any business, whether it is healthcare, non-healthcare, sales is vanity, profits is sanity, and collections is reality. And on that note, I would like to ask Samir, where do you think are the challenges and the opportunities emerging in the investment in healthcare sector?
Thanks. So I think I echo a lot of the points which Casey and Dr. Yadava have made. I think overall as a sector, I think will do well. So the investment opportunities across different segments will be quite attractive. There are some subsectors which will benefit disproportionately more. So for example, the whole, like what I said earlier, whole concept of single specialty, multi-location kind of chains, where you specialize in a particular vertical, let's say eye care or oncology or dental services. I think those kind of businesses which are less capital intensive, where you can be closer to the customer and you can really operate in a safer, perceived safer, non-hospital environment, will I think do quite well in the changed scenario. Pharma is another sector which we all know is doing well, will continue to do well. It's a great opportunity for Indian pharma companies to really push the pedal and become really global leaders. So pharma will do well. Medical devices, I think Casey also spoke about the whole made in India medical devices. Forus as a classic example, will do well, because for many years we have been using multinational company produced devices which are frankly over-engineered for the Indian market. Now, both because of COVID and also what is happening on the border with China, I think the made in India medical devices will get a big boost. And then point of care diagnostics, again, some of the points which were made, data analytics, health technology are some of the areas which will do well. Coming to the challenges, I think one of the big challenges, at least I see in the Indian market, is that pre-COVID and also post-COVID, the government will become a major player in the healthcare domain, both as a regulator, as a purchaser, as a competitor. So I think it would help if there is a lot more efficiency in some of those things. So classic example I would say is procurement systems of the government hospitals. I think for many people who are supplying to the Indian public sector, it is a very difficult process, very time consuming, uncertainty, things keep reversing. So I think if that process can be improved, and I think government has taken some steps like setting up the GM and other such infrastructure, but if more can be done on that, I think that would be good. The second challenge, of course, is talent. The lack or shortage of good quality talent, especially in tier 2, tier 3 cities. I think that also should be something which I think the government is aware of, but hopefully over the next 5-10 years, more will be done there. And third is also the whole doctor community, their receptiveness to buying made in India products, non-branded MNC products is something which I think will have to change. So these are some of the challenges that I see moving forward.
Very, very good points. Your point regarding less capital intensive hospitals, where real estate, I've also heard that real estate players may come together with hospitals to make these smaller places where there is perceived less risk. And that means this chaos. In business, chaos is often a ladder. Only thing is that the tribes which ascend the ladder may not be the tribes which ascended the ladder pre-chaos times. So maybe the nurses, or earlier in the 1918 pandemic, the nurses really got a huge shot of power in the power structure. They came up because the doctors were reluctant to treat the patients and the nurses treated the patients more, but they did not climb that ladder. However, they used that power to get a universal enfranchisement. So I do not know who will be the new players who will rise on these new ladders of opportunities which are coming up. Regarding medical devices, you said yes, supply chains will have to be looked at. Maybe from offshoring, we will go to friendshoring, and we will also ensure that in software and algorithm space, we are strong. In the hardware and prototyping stage, and that ecosystem we will have to build. In point of care diagnostics, very rightly you mentioned. And lastly, just like Dr. Yadav, you spoke about the government. And I'm reminded of another panel where I was interviewing, chatting with Gurcharan Das, where he said that I have written this book. It is called India Grows at Night. And I said, why? What is the meaning behind the title? He says, India grows at night because in the night the government is sleeping. So the sleeping government allows the country to grow. So that is a comment on our government, but at the same time, an overzealous government also sometimes can bring problems, because if the policy is not well thought out or not thorough, then problems can come. We hope that this crisis is making everybody more thorough in their job, and that includes the government. Thank you very much, everybody. You really lit up the place with your fine ideas and crisp delivery. Really appreciate your presence here, and I will pass it on now to Siddharth.
Thank you. Thank you very much, sirs. Our leaders and I have taken home so many nuggets from today's conversation. So much to learn. I wish we had more of your time. I'm still receiving positive messages from our leaders on my phone and on my LinkedIn. While a lot of the questions have been covered, for the ones which we may have missed out due to shortage of time, I will come to you personally with the relevant questions and seek some of your time for the answers. And thank you to our attendees for staying in such numbers till the end. Whether you would like to engage with us on our expert panel, which we're building, or as learners, you're invited to connect with us for membership. We are soon launching our digital professional network professionally, which is exclusively for leaders. The LinkedIn for Leaders is being launched very soon. And we will be sending out invitations to select 1,000 first members across these 4 sectors. So thank you again, once again. It is truly our privilege, and hope we stay connected soon. Thank you. Thank you, sirs.
Thank you.
Thank you, everybody.